ISF process overview for safety and elopement concerns. Generally, it takes about 6 to 8 weeks for a child to get adjusted to a new environment, a new routine, or new interventions. We ask that providers allow 6 to 8 weeks for the child to acclimate, to observe, and identify their needs. Number two, it is important that you connect with families about their child. What are their strengths, struggles, and what works at home? Number three, it is important you consult with your inclusion coordinators and other service providers to implement strategies. Number four, it is important that you are required to consult with your inclusion coordinator to request inclusion support funds. Number five, it is important to collaborate to determine what strategies are working and what are next steps. Once a request is submitted, you will receive one of the following emails: an approval letter with a PDF of your approval letter. Make sure to read thoroughly, as sometimes amounts are adjusted. Not approved, with an explanation. When a request is denied, providers are encouraged to check in with their inclusion coordinators if they have additional questions. Once a request is submitted, here is a response schedule. Please pay attention to the submission window, because that is your opportunity to submit an application. If a submission is received after the date that it closes, then your application will be reviewed in the next submission window. For staffing, allotment is based on a $23.16 an hour salary. ISF cannot be used to pay more than that. If a provider would like to pay this employee more, they are free to do so, but it cannot come out of ISF funds. An additional 30% of salary is allowed for health, vision, and dental benefits. If an employee opts out of benefits, that money cannot be used to increase pay or pay alternative benefits or additional hours. For staffing, ISF can be used to pay for holiday and sick days in alignment with other staff members. ISF cannot be used to pay for additional PTO. ISF is meant to pay for a new role to support with inclusion. It cannot be used to supplement existing staff roles. Providers may not use this funding to support their own income. What PL payments look like? So, some providers will have their contract with PL, and some providers will have their contract with MISO. So it is a monthly allotment. After inclusion support funds have been approved, the PL budgets and contract team will add funds to your PL contract, and MISO will do the same for subcontractors. Inclusion support funds should be invoiced at the same time as pre-K slots, transportation, and infant and toddler stabilization funds. Invoices cannot be submitted until the support staff are hired and scheduled to work for the next month of service. Invoices must be submitted between the 15th and 20th of the month before the month of service. For the first month of service, you will likely have to submit an invoice with only ISF.